Good morning, it's Dr. Larson talking about COVID-19. I'm going to talk about a few things today. I'm going to talk about schools. I'm going to talk about what's happening at Central. I'm going to talk about how your vaccination is waiting for you at your physician's office. So it's reserved, it's waiting, it's ready for you. We'll talk about what's happening with our numbers, but I'm going to start with talking about a study that the University of Washington is doing. It's called the WAVE study, Washington Coronavirus Exposure Survey. So what that study is doing is looking at who might have had COVID-19 in the last year and a half that we didn't really know. So you might be getting a letter in the mail that asks you to be part of a study. Please participate. There's no cost to you. They'll do some blood samples, some nasal swabbing to kind of figure out whether you might have had COVID-19 in the past, to look at what might be happening with our community in regards to COVID. So it's a good study. It'll really be helpful for us to know what percentage of our population might have had COVID-19. Is it 10% of our population might have had COVID-19 in the past, or is it 25%? Because it makes a big difference. So please participate. It's called the WAVE study, W-A-V-E-S. It's from the University of Washington. So if you get something in the mail asking you to participate, please participate, do your part so we can kind of figure this out going forward. I'm going to talk a little bit about our numbers in Kittitas County. Our numbers are really quite good. Currently, our incident rate, that's the case rate per 100,000 per 14 days, it's 51.9. That's still higher than what we would like to be, but it's way better than where we've been in the past. Our percent positive is 1.9%. We'd like to have that less than 5%, so we're certainly looking good there. In comparison, Walla Walla is having a significant problem currently, and we're not really quite sure why. Their incident rate is 314.8 per 100,000 per 14 days. Their percent positive is 15.3%, which means they're probably not testing enough. There's more people out there that are sick. And it's not because we are better than them in regards to our vaccination rate. So they currently, 12 and up, have 56.5% of people fully vaccinated. We have 47.4% fully vaccinated, and the state is sitting at 59.5%. So it may be the Delta variant. It may be that in last year when we asked people to stay at home, that they did a much better job staying at home and they didn't really get exposed to COVID-19 last year, but they're getting exposed to COVID-19 now. We are doing a lot of sequencing of samples down in Walla Walla County. They're having a similar problem that we're seeing in southwest Missouri, for example, where almost all of their samples are Delta variant. Their hospital system is overwhelmed. Every person that's been hospitalized in our county has been unvaccinated. That's what we're seeing in Walla Walla. That's also what we're seeing in Missouri. So there's definitely an advantage to being vaccinated. If you got COVID-19 last year, you are not protected for the Delta variant. So please consider going out and getting vaccinated again. Your physicians are your trusted sources, and your vaccine is waiting for you there. So please give them a call and consider being vaccinated. In regards to schools, most of you know that the CDC came out with guidance saying that vaccinated staff and students do not have to wear a mask in school next year. That's a big change. We don't know for sure what we're doing in Washington State in regards to that yet. I'm on a task force with the governor's office, 3 meetings this week. We hope to have some guidance for Washington schools this week or early next week. California has taken the approach of they're going to require masks in schools going forward because they don't want people to be treated differently. There's a lot of problems with trying to figure out who's vaccinated and who's not vaccinated, but the CDC has said that it's safe to have people that are vaccinated not wearing masks in schools. So we'll see kind of where we land in regards to that. We can talk about that next week. Central Washington University has a new president. They're moving forward with their plan to be a fully vaccinated campus. What that means is that everyone at Central Washington University, either students, faculty, and staff, need to either be vaccinated or have a waiver on online to say that they were choosing not to be vaccinated. A lot of work going on there. That'll be helpful for us as a community in the fall. So enjoy your time out. Please be careful. If you are unvaccinated, you are at risk, and you're at risk of ending up in the hospital, at risk of giving it to others, and at risk of helping us to develop more resistant variants. So please consider being vaccinated. Enjoy the summer. Make sure that you're being careful in the heat. We did not have any deaths in Kittitas County due to heat, but we had a lot of deaths in Washington State due to the recent heat events. So be careful and take care. Thanks.